Hey, Dr. Jerry Williams, Urgent Care 24/7, here to talk to you about vitamin B12. Folks who have low vitamin B12 levels, they typically will get them replaced with an injection. We get a B12 injection. In fact, we have patients who are presenting with decreased energy level, feeling tired. They'll come in and go, hey, I want a B12 shot. We typically will go ahead and give them a B12 shot, but we'll draw a vitamin B12 level first to see what their B12 level is before we give them the injection of the cyanocobalamin, which is the vitamin B12 injection. So we'll draw that level first. Sometimes patients can present, as I mentioned, with fatigue or lethargy, and that's when they'll request the B12 level, but also decreased memory, headaches, pallor. Also, you can even have psychiatric symptoms that can be related to B12 deficiency in extreme situations. I mentioned the pernicious anemia, which is the large red blood cell anemia, and anything that affects normal gastric function can help cause a vitamin B12 deficiency because vitamin B12 is absorbed in the gut. Specifically in the cecum, which is the proximal large intestine in that area. We also, when these patients present with peripheral neuropathy, they'll have numbness and tingling. They'll have decreased muscle tendon reflexes when we tap their knees and tap their ankles and check for reflexes. There'll be a decrease in those reflexes. People who do not eat animal source foods like vegetarians and vegans, they have to be super careful about their vitamin B12 levels because we get B12 and if you're a vegan, you're really at risk because B12 is predominantly seen in animal-based products, but also in milk and in dairy products and in eggs, and vegans don't eat those products, of course. So there's an increased risk for B12 deficiency. In foreign countries like Hong Kong and India, up to 80% of vegans in those countries have vitamin B12 deficiency, so very common internationally. So this is kind of a basic overview of vitamin B12 and its importance. Patients who've also had gastric bypass surgery, again, because of the stomach acid secretion component of vitamin B12 absorption, patients who've had the gastric bypass surgery, they're also an increase for vitamin B12 deficiency. I do want to mention, because we've had discussions about vitamin B12 in regards to COVID-19, and I want to address that here in this little talk. There is really impressive peer-reviewed data that shows that vitamin B12, a healthy vitamin B12 level in the face of a COVID-19 infection is important to keeping the COVID-19 infection at bay and decreasing the likelihood of hospitalization and decreasing the likelihood of death and major complications with COVID-19. So vitamin B12, incredibly important in the long run, but also incredibly important acutely right now during the COVID-19 pandemic. So all of my patients, we're encouraging them to take vitamin B12 in addition to their vitamin D3, vitamin C, magnesium, and zinc. And keep in mind also that there's data that supports that Pepcid or famotidine improves the likelihood of doing better if you get COVID-19. And famotidine, or Pepcid is the trade name, is a H2 blocker, which is an H2 histamine type 2 receptor blocker. We've talked about these in other lectures. These decrease acid secretion. And as I mentioned earlier in this talk, if you're on an H2 blocker or on a proton pump inhibitor, PPI, you're at increased risk for vitamin B12 deficiency. So in the face of COVID right now, we're encouraging all of our patients to be on daily vitamin B12 and getting their vitamin B12 levels checked. Super important. We'll be talking about the other vitamins and minerals in other lectures in regards to your overall general health, but also in regards to your health during the COVID-19 pandemic. So I hope that this lecture today on vitamin B12 has been useful to you. There's a lot more information. Vitamin B12 is a fascinating vitamin, incredibly important in all kinds of cellular function, from DNA synthesis to fatty acid and amino acid metabolism. Again, it's hard to find a part of the cell where vitamin B12 is an important component of that cell's normal function and metabolism. So I hope you found this interesting. I've certainly enjoyed talking to you about it today. And I'm Dr. Jerry Williams with Urgent Care 24/7. Life is 24/7, and so are we.